Hello, I am Lauren Bukta and I chose to do my oral presentation on syphilis. So, what is syphilis? Syphilis is a sexually transmitted infection, also known as an STI. It is known for its multi-stage progression and potential to cause long-term health issues if left untreated. If left untreated, syphilis can cause serious complications and even death. Something that I found very interesting doing my research was syphilis can have severe consequences for unborn babies if transmitted from an infected mother during pregnancy. The risk to the baby is miscarriage or stillbirth, preterm birth, and low birth weight. Syphilis is caused by a bacterium that has a distinctive spiral shape, and it is called Treptoneum papillomatum. Syphilis is transmitted through sexual contact. It's primarily spread via sexual contact, including oral, vaginal, and anal sex. It can also be transmitted from mother to child during pregnancy, leading to congenital syphilis. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. In the primary stage, the symptoms are painless sore at the infection site. Typically 3 weeks after exposure is when it appears. In the secondary stage, the symptoms include skin rash, mucous membrane, lesions, fever, and swollen lymph nodes. In the latent stage, the symptoms are no symptoms. It can be latent in the body for years. In the tertiary stage, which is the late stage, the symptoms include severe complications affecting organs like the brain, heart, nerves, and bones. The signs and symptoms by stage. In the primary stage, you have canker sores, which are painless ulcers around the genitals, anus, and mouth. Secondary syphilis, there's rashes on the palms, soles of the feet, flu-like symptoms, fever, muscle aches, mucus patches in mouth, and swollen lymph nodes around the neck. Latent syphilis means there's asymptomatic infection. It can still progress into something bigger. In the tertiary syphilis, there are gumas, which are destructive lesions, cardiovascular, and neurological damage, and that's why it's so important to get treatment as soon as you find out you have syphilis. The treatment of syphilis, the first line is usually an antibiotic called penicillin G. It is an IM injection. For that, it's usually a single dose of penicillin for early syphilis. If that's not working, there's an alternative for people with penicillin allergies, and it's doxycycline or azithromycin, which is an oral medication. Depending on how extensive the syphilis is, they may do longer courses for late or tertiary syphilis. It is important to schedule follow-ups for regular testing to ensure the infection is cleared, especially in pregnant women, to prevent congenital syphilis. Cause and transmission of syphilis. As I stated before, the causative agent is Treptoneum papillomatum, a spiral bacterium. The transmission is through sexual contact. Congenital transmission is mother to child during pregnancy or birth. And in rare circumstances, you can contract syphilis through a blood transfusion. It is uncommon with modern blood screening. Prevention of syphilis. Safe sex is highly used to prevent syphilis. For the use of condoms, a routine screening is recommended for all individuals, male or female, who are sexually active, especially those at high risk. It is very, very, very important to always notify your partner if you come in contact with somebody that has been treated for or potentially has syphilis. Education and awareness. Public health campaigns to reduce stigma and promote early diagnosis so we don't get into those late stages of syphilis. Fun facts about syphilis. Syphilis is often called the great imitator because its symptoms resemble those of many other diseases. This can make it difficult to diagnose without specific testing. Historical epidemics. Syphilis first spread across Europe in the late 15th century around the time of Columbus's return from the Americas. This led to debates on whether it originated in the New World or if it was already present in Europe. Another thing that I thought was very interesting was the name blame game, because I hear this so often with people blaming others for contracting the disease, and it's always the other person's fault. Throughout history, syphilis was often named after other countries. For example, the French called it the Italian disease, and the Italians called it the French disease. Each country blamed its enemies for bringing the infection. A rise in the modern era. While syphilis rates declined with the discovery of penicillin, they have been increasing again in recent years. This rise has been attributed to factors such as reduced stigma around HIV, dating apps, and lack of syphilis awareness. And that is why it is so crucial to make sure you get your checkups in and your appointments with your physician to make sure you do not have syphilis. Here are some pictures of syphilis. On the left, it is the rashes on the palm of the hands. And in the middle picture, it shows the primary and the secondary, what the symptoms can look like. And then on the right side is just the stage, the timing, and the features. And here is a short video of the warning signs of syphilis and a syphilis wrap-up of everything that we have included in this presentation.